Stephen, thank you very much for having me. So my name's Jerry and I'm a primary learning disability liaison nurse.
What is a flu jab?
Well, a flu jab is a vaccine, and a vaccine is a type of medicine that teaches our body how to fight and beat flu.
When should you get one?
We should really get one the autumn time and the beginning of winter, because once winter sets in, that's when there's more flu around. The most amount of flu around is during the winter time.
Where can you get one?
Well, a lot of GP surgeries will do the flu vaccine. Some of the smaller GP surgeries don't have enough room to store them, so they might suggest you go to a local bigger surgery. But also some chemists and pharmacists will give you the flu vaccine as well if needed.
And who can have one?
Well, anyone who's over 65 years old, people with certain health conditions like asthma, or if people are getting treatment for cancer, things like that. People who are pregnant, they can have one. Also people living in residential nursing homes, they can have one. Also, people who have got a family member who might become very poorly, if the family member caught flu, then you'd be able to have a vaccine. But also staff who work for the NHS or social services or who are care staff, they're also entitled to have a flu vaccine.
My friend is worried that it'll hurt. What can help her?
So the nurses or whoever's doing the vaccinators can do a couple of things. They can use Emla cream, type of cream that you rub on the arm where you're going to get the injection, the vaccine. And what the cream does is it makes that area of skin go numb for a few minutes, which then means they can't feel the needle going in. But the other thing that some people find helpful is buzzy foreshots. So if I can just show you this, this is what it's called. It's a very clever bit of kit. So what happens, Stephen, is just before, if I was going to be giving you your vaccine, just before I would see you, I'd have these wings here in a freezer, so they're all frozen. And then when you came in to see me, I'd put this on your arm. I've got a strap there I could attach it to, and then I'd switch it on. You feel it buzzing. And so the way it works is the frozen wings and the buzzing of this bee here makes your arm go numb, probably for about 10-15 minutes. So when it's time for your vaccine, they just switch it off, they just light it up a little bit, do your vaccine there, and you wouldn't feel a thing. And they could take it off. And then about 15 minutes later, your skin there would feel just completely back to normal.
What are some reasonable adjustments people might need if they have their flu jab at the GP surgery?
Well, I think giving people a choice of what time to go, like they did you, what appointment to have, I think that really helps. I think giving people information that's really easy to read and understand is really important. Maybe having a bit more time so that things can be explained, that would be another reasonable adjustment. Taking somebody with you if you're a bit anxious, a bit nervous, that'd be a reasonable adjustment. One of the best ones I've heard of surgeries doing was to let somebody have their vaccine in the car while they were waiting in the car park at the GP surgery because they were a bit too nervous to go in. So there are lots of reasonable adjustments that can be given.
Yeah, because if anybody's like in a wheelchair or anything, or they can't go in the surgery, or if there's no reasonable adjustments, you know, people who are disabled and that, then they probably the best thing is to have it in the car park, and then they don't then see so many people in the surgery as well.
It can really help some people, but this is a really important thing, I think, when you talk to the surgery to book your flu vaccine, that's the right time to be telling them about what you might need to make sure it goes smoothly, what reasonable adjustments you might need. thank you for inviting me, and it's been really good seeing you and talking to you again.
Yeah, well, thanks very much for coming along.
This film was co-produced by staff at Ace Anglia and colleagues from NHS Suffolk and North East Essex. For more information, contact info@aceanglia.com.